In the past 2 years, the issue of concussions relating to football have dominated headlines, and this year, an estimated 250,000 kids 19 years of age and younger will be treated in the ER for a concussion. So joining me this morning is Dr. Jeffrey Mjaanes of Midwest Orthopaedics at Rush Sports Medicine. He is also the director of the Chicago Sports Concussion Clinic at Rush. Dr. Mjaanes, thanks for being on the program this morning.
Thank you for having me.
You brought in what you say are some newer model helmets. Are these making a difference at all?
I think, in a way, yes. This is very exciting technology that is out there. Some of the big helmet makers have actually come out with newer technologies to try to eliminate some of the forces on the brain. So some very exciting things. There's also some inserts that can go in a helmet and caps that can go on the outside of a helmet. So I think these are exciting technologies, like I said, kind of cutting edge, and there may be a point in the future where this could be standard. Right now, though, there are some concerns that I have about some of these things.
Okay, well, first off, how many leagues or park districts are actually using these kinds of things? This is the insert, and this is the pad that goes on the outside of the helmet.
Right. Well, definitely, as the technology is new, schools, especially school districts with more money, tend to buy kind of the newer equipment. And a lot of parents out there, would like to protect their child in the best way that they can. So they feel like this is new equipment, and we need to get out there and get it for them.
You mentioned you still have some concerns, though. What are they?
Well, some of the things, so some of these helmets, for example, have been designed it's pretty neat, actually. They've been designed so that they can dissipate the forces a little bit better on the brain, and hopefully that would then reduce the forces that would cause a concussion. But some of these have not been fully tested, especially on a youth helmet form. So while it may work maybe for a college-age player, will it work for your 8th grader? Right,
with a smaller head, a smaller model.
Correct. And then some of the fear is, too, that you're actually increasing the weight of the helmet, which actually would create more of torque on the neck. So,
and for parents out there, who may have children in football or children playing hockey or other kind of high-impact sports, my understanding is there's no way to completely eliminate the risk of a concussion, true?
That is true, and I think, so helmets, having a proper fit and having a newer helmet could be beneficial, and maybe someday we will actually develop a helmet that could really minimize the risk. But right now there's no 100% way to minimize your risk of having a concussion, to eliminate the risk, I should say.
So that in mind, no way to eliminate the risk. What's your message to parents who may be watching out there this morning who are still kind of weighing whether to let their son or daughter play these high-impact sports?
Well, I think the most important thing is actually education about concussions. If the athlete knows the risk, the parents know the risk, then, if they have signs and symptoms after a hit to the head, get seen right away so we can intervene at that level.
Okay, and it's also about how you play the game as well. Sportsmanship, following the
rules. Follow the rules, play fairly, play just, no bad hits, things like that.
Okay. Dr. Mjaanes, great information.
Thank you very much.
We gear up for football season.
Thanks for having me.
Across the country. Susan, we'll send it back to you.